Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. NEETPG mock test 3. So we have totally 30 full scale grant tests. For every grant test, I give you 200 pages PDF, which has got the color illustrated, hand sketched mind map infographics of explanations where every question is accompanied by 10 high-yield facts that you need to remember. So by solving one full-scale grant test, you are once more reinforcing 200 high-yield facts, almost 2,000 high-yield facts, 200 into 10. And 30 full-scale grant tests will equip you with almost 50,000-60,000 high-yield facts, which are the most frequently asked questions in the exam. What more do you need to become a winner once you solve these 30 full-scale grant tests? With that preamble, let's make the great beginning, Doctor. Can you please punch? Is the voice loud and clear for all of you? Can you please punch? Can you get some water, please? A 2-day-old neonate presents with severe cyanosis and respiratory distress. And what is the radiograph showing, doctor? Agon string appearance, which is the classical feature of the transposition of the great arteries. In this infographic, you can see there are about 10 points for each MCQ that we practiced in the mock test. 48-year-old woman with sudden onset of the pleuritic chest pain with dyspnea and hemoptysis after immobilization is pulmonary embolism, and a wedge-shaped opacity which is called the Hampton's hump is being given to you in the image-based question. A 35-year-old with chronic productive cough, high-resolution CT scan is being performed. And what is a very important feature, doctor? Signet ring sign. Signet ring sign has been given to you in the HRCT, which is the classical feature of bronchiectasis. So there are 10 points about bronchiectasis and radiology that you need to remember, which is being given in the infographic to you. A 62-year-old with progressive exertional dyspnea, high-resolution CT, classically showing the honeycombing, which is the classical feature of idiopathic pulmonary fibrosis, is what you have to remember. So what are the two drugs? Pirfenidone, nintedanib are the ones which are typically used in case of the idiopathic pulmonary fibrosis. 45-year-old with prior history of pulmonary TB, CT chest is being shown. There is a fungal ball in the pre-existing cavity, air crescent sign being positive is the feature of aspergilloma. 42-year-old, distal interphalangeal joint involvement is there. Dip involvement is the characteristic feature of psoriatic arthritis and osteoarthritis. So only two conditions which you need to remember. So the pitting, onycholysis, subungual hyperkeratosis, they're all the features of the psoriasis is what you should remember. A 50-year-old woman presents with chronic symmetrical pain and morning stiffness. Classical of rheumatoid arthritis, where you can see juxta-articular osteopenia, marginal erosions, they're all the characteristic features. There'll be ulnar deviation, subluxation, they're all the features. So I leave to you the literature. 10 points about each of these MCQs try to do the revision in the form of easy to remember picnomic infographic mind maps that make you easy to remember that. Good. Good to see Get Going and many more who are all online. Can you please punch as a voice loud and clear for all of you, doctor? A 46-year-old man with chronic kidney disease. The spine radiograph has been shown to you, which is showing the Rugger Jersey spine, which is the feature of hyperparathyroidism, is what you have to basically remember. The Rugger Jersey spine, the brown tumor, muscle weakness, bone pain, decreased calcium, increased phosphate, increased PTH, they're all the features. Subperiosteal resorption, they're all the features of hyperparathyroidism. A 12-year-old boy, subependymal nodules, multiple renal angiomyolipomas, and shagreen patch and ash leaf spots, which are hypomelanotic white spots, is the feature of the neurocutaneous syndrome called tuberous sclerosis. A 32-year-old with a history of IV drug use, fever, malaise, typically developed the JNV lesions and Roth spots and Osler's nodes. You should know all the features of the infective endocarditis in the image-based questions. 7-year-old with erythema infectiosum, slapped cheek appearance, parvovirus B19. Please don't forget that. A newborn delivered to mother with a poorly controlled diabetes. Chest radiograph was showing a boot-shaped heart, which is the classical feature of tetralogy of Fallot, is what you need to identify in the image-based questions. An infant has congenital cataract with sensorineural hearing loss and failure to thrive, is the classical congenital rubella syndrome. A 50-year-old man, abdominal distension with a colicky abdominal pain with vomitings, and typically string of pearls appearance on the X-ray. Abdomen is small bowel obstruction, which shows dilated loops, multiple air fluid levels, which is a very classical feature. A 68-year-old presents with sudden onset abdominal pain followed by bloody diarrhea. Peripheral vascular disease. So once peripheral vascular disease is there with the atherosclerotic narrowing of the peripheral blood vessels, the same atherosclerosis involves the mesenteric vessels and lead to ischemic colitis is what you need to remember. And what do you see, doctor, in ischemic colitis? Thumb printing sign, which is due to submucosal edema and hemorrhage, is what you need to remember. A 34-year-old shepherd, dull right upper quadrant abdominal pain. Typically, there is a giant cyst in the liver. Water lily sign, classical of hydatid cyst. So hydatid cyst, liver is the most common site, right lobe more than the left lobe, and lung is the next most common site. And the ELISA, to recognize the IgG, has a very high sensitivity, is what you have to remember. A 62-year-old with chronic right upper quadrant pain. Abdominal imaging was showing calcification of the gallbladder wall, is a case of the porcelain gallbladder, is what we should remember. A 45-year-old with a history of chronic alcohol. Abdominal radiograph is showing colon cutoff sign, where there is a ileus colon cutoff sign, typical of acute pancreatitis is what you have to basically remember. So gallstone, ethanol, trauma, steroids, mumps, autoimmune, scorpion sting, hypertriglyceridemia, ERCP, they're all the causative risk factors for the development of the acute pancreatitis is what you need to remember. A 36-year-old woman with cyclical breast pain, multiple bilateral breast nodules that vary with the menstrual cycle, which is very classical of the fibrocystic disease. You find multiple anechoic cysts of varying sizes, which is called the Swiss cheese appearance, is what we have to basically remember. Now, a 14-year-old boy presents with recurrent UTI, intermittent flank pain, IV urography was done, and there is a cobra head appearance, which is typical of ureterocele, which is the cystic dilatation of the distal ureter within the bladder, is what we have to basically remember. So what you need to do is, you will receive on WhatsApp the PDF of all the 200 MCQs of the mock test, each with 10 points to remember as the infographics for you to do the revision. This is the most effective way of preparation for NEETPG. 30 full-scale mock tests, 30 PDFs, each containing 200 infographic images. So you get 6,000 infographics. Each has got 10 high-yield facts. Sure shot to come in the exam. That's all. What more you need? Just taking mock tests only, also people cracked the top rank in the NEETPG. So powerful, so predictive, so probable are the 200 MCQs that come in the tomorrow's NEETPG exam. So, doctor, a 3-year-old boy with a poor urinary stream, recurrent UTI, micturating cystourethrogram is showing a voiding defect, which is typical of posterior urethral valve. It's called the keyhole appearance, is what you need to remember. During cranial base dissection, at the junction of the petrous part of temporal bone and occipital bone, what do you have? Jugular foramen. Through the jugular foramen pass, the 9th, 10th and 11th is what you need to remember. Every NEETPG you go, one question, sure shot to come on the various cranial foramina and what are the contents of the cranial foramina. You need to be doubly sure about that. The lymphoid organ, which is showing eosinophilic whorls within the medulla. They are called Hazel's corpuscles. They are the epithelial reticular cells arranged in concentric whorls. Hazel's corpuscles are the hallmark of the thymus gland, is what you need to basically remember. A histological section from the GIT is showing Brunner's glands, which are the mucus glands in the submucosa, as what you can see, which is the hallmark of the duodenum. Every NEETPG you go, one MCQ invariably on the histology, epithelium. You need to be doubly sure, doctor. During autopsy of a firearm injury victim, skull revealed internal beveling of the cranial bone defect. That is the entry gunshot wound. The exit wound will have external beveling. That is the difference. So if you look at entry versus exit, it is basically by the beveling. The direction of beveling is the differentiator. If you see entry wound, there is an abrasion collar, which is very classical. Tattooing, where powder blackening of the skin is in entry wound. Unburned powder is there on the skin, which is called sooting. Punctate hemorrhages due to hot gases, it's called stippling. So I leave the literature for you. You need to be very sure entry-exit wounds in forensic medicine is a favorite image-based MCQ that you need to basically remember. So now, doctor, 58-year-old with progressive fatigue, weight loss, teardrop cells are being shown in the peripheral smear, is a classical feature of myelofibrosis. Favorite question of the examiner. Age more than 50, males more than females. They present with anemia, massive splenomegaly due to extramedullary hematopoiesis is the characteristic feature which you see in case of myelofibrosis. 40-year-old with abnormal uterine bleeding, unilateral ovarian mass. What do you see here? Call Exner's bodies or the classical histology in case of the granulosa cell tumor is what you need to understand. A 36-year-old woman with heliotrope rash. Classical proximal muscle weakness with heliotrope rash is the feature of the dermatomyositis is what you need to basically remember. The CPK is increased, aldolase is increased, AST-ALT increased. And if you do electromyography, short duration, polyphasic, small amplitude waves are the typical myopathic EMG pattern. And what is very important hallmark? Perifascicular, not interfascicular. Perifascicular atrophy, inflammatory infiltrate is the important histological feature. So, what are the autoantibodies that you see in dermatomyositis is the favorite question of the examiner. 27-year-old man presents with a chronic cough, low-grade fever, weight loss, and intermittent hemoptysis. Is a classical feature of endobronchial tuberculosis, where it is called tree in bud. Tree in bud appearance is very important in endobronchial tuberculosis. 16-year-old presents with progressive limb hip pain. There was a shepherd crook deformity, which is the classical feature in case of the fibrous dysplasia, where you have the ground glass appearance. Shepherd crook deformity in case of fibrous dysplasia. A 62-year-old develops sudden weakness of the right upper and lower limbs after a stroke which is involving the internal capsule. So, through the internal capsule will pass the corticospinal tract. That's the reason there is a development of hemiplegia. So, pyramidal tracts, corticobulbar tract, UMN lesion, LMN lesions, rubrospinal tract, everything you should know, doctor. I leave the literature to you. Now, a 55-year-old has an inability to speak fluently. Broca's area, which is in the inferior frontal gyrus, is the one which is affected. So you should know where is the sensory cortex, which is post-central gyrus, Brodmann area 312. Precentral gyrus is primary motor cortex, which is the Brodmann area 4, is what you have to basically remember. Now, a 48-year-old undergoes the parotid surgery for a benign tumor. Which nerve is most likely affected, doctor? It is the facial nerve, which has got a very close relationship. And where is the Stenson's duct opening? Opposite second upper molar tooth. And what does parotid duct pierce before opening? Buccinator muscle. And what is the innervation? It is via the lesser petrosal nerve, otic ganglion, postganglionic fibers supply secretomotor fibers to the parotid gland. So glossopharyngeal is very important. Sympathetic innervation comes from superior cervical ganglion. Sensory supply comes from the great auricular nerve, which is C2 to C3. So you need to be very sure on the parotid anatomy. A newborn develops bilious vomiting after the birth. Imaging shows malrotation of the intestine with the volvulus due to abnormal embryological rotation of the midgut. Around which artery does midgut rotation occur, doctor? Superior mesenteric artery. Right? So please make sure what are the branches. You have middle colic, right colic, ileocolic, jejunal, ileal. They're all the branches of the superior mesenteric artery is what you need to remember. So I leave the literature for you, doctor. The whole purpose of the mock test is to anchor you to do the revision, which is very important. A healthy 70 kg has an estimated total body water of 42 liters. What is the volume of the intracellular fluid? So total body water is 60% of the body weight. Right, doctor? So 70 kg man has got 42 liters of total body water. In that 28 liters is the intracellular fluid. So 2/3 is ICF, 1/3 is ECF out of the total body water, which is 60% of the body weight. That's what we need to remember. A neuron is stimulated repeatedly in rapid succession. During one phase of the action potential, no additional stimulus, regardless of the strength, can be able to generate another action potential, which is called absolute refractory period, is what you have to remember. Once more, muscle contraction, nerve stimulus, neurosynaptic junction, favorite topic of the examiner. A patient treated with the loop diuretic and developed calciuria. So the normal reabsorption of the calcium occur in thick ascending limb of loop of Henle. Who drives that? It is the sodium potassium 2 chloride co-transporter, which create a positive luminal charge, which lead to the calcium reabsorption. The moment you give a loop diuretic, you block the sodium potassium 2 chloride, you are blocking the positive luminal charge and causing the calcium reabsorption affected, and that lead to calciuria is what you need to basically remember. A researcher studying the GLUT4 receptor. What is the intracellular pathway responsible for the metabolic effect? Whenever the insulin comes, it binds with the GLUT4, and that typically will cause phosphatidyl 3 kinase pathway, which is the underlying mechanism for the insulin to let the glucose enter into the cell, is what you have to basically remember. So what are all the effects of the insulin and the glucagon on the various metabolic pathways like glycolysis, citric acid cycle, fatty acid synthesis, degradation? You need to be having in tips, doctor, favorite question of the examiner. Melanate is an inhibitor of succinate dehydrogenase. A cancer patient receiving chemotherapy, impaired DNA synthesis because of inhibition of the thymidylate synthase. So you need to know carbamyl phosphate synthase, 1 is there in urea cycle, 2 is there in pyrimidine synthesis. That typically will make the carbamyl phosphate produced in the cytosol. That become dihydroorotate in the mitochondria, become orotate in the cytosol, become orotate monophosphate. That in turn will form uridine monophosphate. That will form the uridyl triphosphate, deoxyuridyl triphosphate, deoxyuridyl monophosphate. So the 5-fluorouracil basically comes here, right? Thymidylate synthase. That is the one which is inhibited, and that affects the production of the pyrimidines is what you need to basically remember. Now, doctor, a researcher studying the eukaryotic DNA replication identifies there is an enzyme responsible for the synthesis of the leading strand with high fidelity. We are talking about DNA polymerase epsilon. So what is DNA polymerase 1, 3, helicase, primase, DNA polymerase alpha, delta, epsilon, topoisomerase, ligase, all these 1, 2 points, which are very unique for them. You need to remember, doctor. Raw egg whites, it is the biotin deficiency which typically develops. Biotin is a very important coenzyme in all carboxylases. Pyruvate carboxylase, propenyl-CoA carboxylase, acetyl-CoA carboxylase. Any carboxylation required, biotin is what you have to basically remember. A 27-year-old man, the organism typically is a gram-positive cocci showing alpha hemolysis on the blood agar. It is autogen resistant and bile insoluble. So what is that organism, doctor? It is the Viridam streptococci. Whenever you go to the NEETPG, microbiology means streptococci, staphylococci. Without that, there is no question paper, is what you have to basically remember. So Medisa is asking, sir, feeling very anxious, only 3 months remaining. Sir, please guide how to best utilize these 3 months. Good. Melissa, मुझे टेंशन नहीं आ रहा है. I'm not feeling anxious. Why? Because not that I remember all 19 subjects. I know what examiner is going to ask in those 200 questions by. Right? How, if you analyze the past 6,000 PYQs, there are hardly 400 topics from which 85% question paper comes. Another 400 topics पढ़े तो 100% you know how to predict the examiner. Get the list. 2-3 साथियों के साथ बैठो, right? And Thursday, Sunday mock test and discussion participate करो. बस सीट आएगा, क्यों नहीं आएगा, right? दौड़ते हुए आएगा, right? And below you have the phone number 9008688356. WhatsApp to this number, and they forward me your number to me, and we'll get connected on the WhatsApp. Anytime, जब भी आपको tension आए, WhatsApp पे, I'm like a 24/7 helpline for you, right? Nothing to feel anxious. By feeling anxiety, we will only forget the subject. We'll make it messy and miserable. No point. Who is responsible for us? We are only responsible for us. Uddhared atman atmanam atmanam avasadhaye atmaina atmano bandhu atmaiva ripuratmanaha atmaina atmano bandhu. Who is the best friend to oneself? Oneself is best friend to oneself. Who is the worst enemy to anybody? He himself is enemy to himself. Says our Upanishads, Puranas, Gita, everything. So don't become an enemy. Don't defeat your beautiful intelligence that made you to become an MBBS doctor. The same intelligence, the same willpower, the same grit, the same hustle will make you to become the topper. It's good. Nobody will prepare 12 months seriously. Let me tell you. Last 3 months only, जो दौड़ेगा वो 2020 मैच जीतेगा, right? जो डर गया वो मर गया. That's what you need to remember, doctor. So now, so please go through what are gram-positive cocci, how to differentiate one from the other, favorite question of the examiner. 36-year-old HIV positive with headache, fever, neck stiffness, CSF showing, negative staining technique, India ink stain, Cryptococcus neoformans, you should not forget. Right, doctor? So, Mason Fontana detects the melanin. PAS, periodic acid shift stains glycogen. Gomery methenamine stain for Pneumocystis carinii, and also best fungal stain. Musicarmine for Cryptococcus capsule. India ink negative stain for Cryptococcus. KOH mount is used once more for fungi. So like that, you need to be very sure what are the various stains. Where are they important? If you look at the previous INA CT NEETPG question bank, one question comes on stain. A 42-year-old with acute myeloid leukemia, KOH mount from the bronchoalveolar lavage shows hyphae with acute angle branching. Acute angle branching बोलते ही आप याद रखना, it is Aspergillus fumigatus, which is very common in the people who have a prolonged neutropenia, is what you have to basically remember. A 6-year-old with parvovirus B19, what type of virus is it? It is a single-stranded DNA virus leading to erythema infectiosum. Herpes, hepatna, pox are double-stranded enveloped DNA viruses. Hipapo, double-stranded naked are adenopolyoma and papilloma. And popa, single-stranded DNA is parvovirus. So that is how you need to remember all these different varieties. Double-stranded enveloped DNA, double-stranded naked DNA, single-stranded DNA, positive-stranded RNA, negative-stranded RNA, segmented RNA. So orthomyxovirus, reovirus, they are all segmented RNA. Circular DNA, papilloma, polyoma, hepatna, they are all circular DNA. A 45-year-old man on anti-tubercular therapy, so develops peripheral neuropathy. Typically, if you look at the drug metabolism, phase 1, oxidation reduction hydrolysis. Phase 2, gas, glucuronidation, acetylation, and sulfation. So, slow acetylators, fast acetylators. Acetylation, if it is slow, then there is a greater risk of developing peripheral neuropathy, is what you have to basically remember. If the glucuronidation is slow, then chloramphenicol toxicity will occur. So I leave the literature for you to quickly revise. Favorite question of the examiner. A 28-year-old farmer is brought to emergency with excessive salivation. Is organophosphor poison, which lead to irreversible inhibition of the acetylcholine esterase, is what you have to basically remember, that causes excessive acetylcholine activity. That is responsible for the excessive salivation, is what you have to remember. 6-7-year-old with benign prostatic hyperplasia received an antiarrhythmic. A few days later, he presents with acute urinary retention. So you should remember, diisopyramide has anticholinergic effects. Hence, it is contraindicated in the people who are having benign prostatic hyperplasia and in glaucoma. Procainamide has a risk of SLE. Quinidine can cause Torsades de Pointes. These 3 drugs are class 1A drugs. Class 1B, lidocaine and mexiletine. Lidocaine is used to treat after MI, ventricular arrhythmias. Lidocaine blocks inactivated sodium channels. And the main side effect of lidocaine is CNS. And class 1A prolongs the duration of the action potential. Class 1B shortens the action potential duration, is what we have to remember. A 58-year-old man established atherosclerotic cardiovascular disease. LDL cholesterol 210, you need to start high dose atorvastatin 40 to 80 milligrams, not 10 or 20. Apoptosis is the favorite question, doctor. Caspases are activated immediately by, after the activation of the EPOF1, it is a caspase 9. EPOF1 will make caspase 9. So you should know the BAX gene, the BAC gene, intrinsic pathway, importance of cytochrome C release, everything in relation to apoptosis. Invariably, there is a MCQ. A patient on chronic inflammatory disease develops pulmonary fibrosis. Which cytokine is responsible for fibrosis? TGF beta. TGF beta causes fibroblast activation. So all the cytokines, what is their source? What is their action? What is their significance? Favorite topic of the examiner, doctor? Good. So, a 68-year-old with a long-standing left-sided heart failure develops progressive dyspnea. So, sputum cytology shows macrophages containing coarse golden brown cytoplasmic granules that stain positive with Prussian stain. Hemosiderin-laden macrophages, because of the chronic pulmonary congestion, is what you have to remember. They're called heart failure cells. Prussian stain will be positive. And there is a red centrilobular and pale periportal areas, which is called the nutmeg liver. In the spleen, chronic venous congestion lead to gamma Gandhi bodies, is what you have to remember. A 52-year-old diagnosed with invasive ductal carcinoma. There is an overexpression of the transmembrane growth factor associated with an aggressive tumor behavior. Started on trastuzumab. Trastuzumab acts on HER2 and ERBB2 receptors. Herceptin, trastuzumab is what you have to remember. So FLT3 mutation is typically seen with acute myeloid leukemia. c-KIT mutation, gastrointestinal stromal tumor. RET mutation, medullary carcinoma, thyroid. RET loss of function in Hirschsprungs. And amyloid deposits with calcitonin in case of medullary thyroid carcinoma. KRAS, HRAS, NRAS. Oh my God. You need to remember all these things by heart for the tomorrow's NEETPG. These are all sure short questions, doctor. No doubt about it. 30 full-scale mock tests. I'll give you 30 PDFs created as hand-sketched, color-illustrated, infographic mind map, picnomics, that will make your preparation completely visual. Remember it, reproduce it, is the rule of the game. So let us give 5 minutes of voice break, doctor. 5 minutes of voice break. So, welcome back to the session, Doctor. Continuing our journey from question number 56. A man is brought to the emergency with firearm injury in the chest. Examination show multiple pinpoint punctate abrasions surrounding the entry wound. What is this called? Tattooing, otherwise called stippling. Abrasive collar, grease collar, contact shot, close shot, near shot, intermediate shot, distant shot. How do you differentiate? Favorite question of the examiner. A habitual cannabis user has recurrent episodes of the vivid visual hallucinations, which are called the flashback phenomena, is what you have to basically remember. So what is bhang? Dried leaves, less than 15% of cannabinoid, whereas ganja is dried female flowers. Hashish and charas is the dried resin. So you need to know all this terminology. Substance abuse is a favorite topic for both forensic and the psychiatric. A sexual assault victim presents 8 months often after the alleged incident and preserved stained garment for forensic examination. Old seminal stain, we use creatinine phosphokinase test. So I leave all the tests basis for the seminal stain, blood stains in the forensic medicine, favorite question of the examiner. A sexual assault victim, we finish this. A 4-year-old diabetic reveals wet newspaper appearance. It is typically seen in Aspergillus niger. When there is an otomycosis, there is a pain plus discharge from the external auditory canal. Wet newspaper appearance is the appearance of the Aspergillus niger. 16-year-old with a foul-smelling ear discharge and hearing loss. Marginal perforation of the posterior quadrant of the tympanic membrane with keratin debris. It is secondary acquired cholesteatoma. So what is the most common site of perforation, doctor? It is posterior quadrant. Most common root of secondary cholesteatoma is marginal perforation. And primary cholesteatoma, it is the retraction pockets in the tympanic membrane, primary. Then invagination due to Eustachian tube obstruction is called the Whitmark theory for the cholesteatoma. So you should know, when you go through this visual picnomics, it is very easy to remember, doctor. A 28-year-old woman with a progressive bilateral hearing loss. She reports hearing conversations better in noisy environment is equal to otosclerosis. और एक कंडीशन को सोचना भी नहीं, right? So common question. So it is autosomal dominant, bilateral involvement, paraxis Wilsey, Schwartz sign, and Rini negative. Weber lateralized to Versier. Absolute bone condition is normal. Gelly's test is negative because of the fixed ossicular chain. Pregnancy, measles is the precipitating factor. And the most common type is fenestral type. So you need to have all this 1, 2, 3, 4, 5, 6, 7, 8. ऐसा otosclerosis बोल के scratch करे तो सब कुछ बोल देना. That's how you need to prepare for the NEETPG exam with the most standard topics. Now, doctor, 40-year-old with recurrent episode of severe vertigo. So, vertigo, tinnitus, nausea, fullness in ear, low frequency hearing loss is equivalent to the Meniere's disease. 58-year-old carpenter has a unilateral nasal obstruction with bloodstained nasal discharge. So you should know that paranasal sinus carcinoma, tumor in the ethmoid sinus, is adenocarcinoma by nature. Now, a 24-year-old farmer brought to emergency department. Sweating bronchospasm means OP poisoning. It is a parasympathetic overstimulation that lead to development of the pinpoint pupils. 42-year-old bitemporal inferior quadrantanopia. You need to think of pituitary adenoma, which is causing the compression. So you should know, doctor, optic nerve lesion lead to ipsilateral anopia. Most susceptible to ischemia are always the central fibers, which are macular. And central scotoma is the first visual field defect whenever there is any optic neuritis. Then optic chiasma lesion lead to bitemporal hemianopia. Pituitary adenoma lead to inferior chiasmal fiber involvement. Craniopharyngioma lead to superior chiasmal fibers. So bitemporal inferior quadrantanopia is a feature of pituitary adenoma. Bitemporal superior quadrantanopia is craniopharyngioma. So that is how one MCQ on visual field defects. Sure shot. 29-year-old woman, Marcus gun pupil, sudden painful loss of vision in one eye that worsens with the movement of the eye. You need to think of optic neuritis, Marcus gun pupil. Pulfrich phenomena, that is altered perception of the motion. Pain with the movement of the eye. You have to give IV, methylprednisolone, high dose. Avoid oral steroids alone is what you have to remember. 55-year-old presents with the drooping of the right eyelid, ptosis, outward deviation of the right eye. Immediately think of oculomotor nerve palsy. 12-year-old boy, vertical diplopia and a compensatory head tilt towards the left side. There is a right hypertropia that worsens on the left gauge on the right head tilt. Then you need to think of right superior oblique. So superior oblique is the muscle supplied by the cranial nerve 4. It is there. The nucleus is in the midbrain near inferior colliculus. Typically, it innervates the contralateral superior oblique. And there is a loss of intorsion that lead to extorsion and diplopia. And the hypertropia, which is worse on adduction, is very classical. So they put a chin down posture to compensate, and the head will be tilted to the opposite side, is what you have to basically remember. So this is a favorite question of the examiner, doctor. Superior oblique paralysis, how will be the head deviation, chin movement, hyperopia, etc., etc. Okay. Now, 65-year-old develops severe ocular pain, redness, sudden loss of vision 3 days after the cataract surgery. So you need to think of endophthalmitis as a complication, and you need to give intravitreal vancomycin, and ceftazidime is considered to be the treatment of choice. A 22-year-old falls on an outstretched hand. Anatomical snuff box tenderness is there. You need to think of scaphoid fracture. And typically we do oblique and lateral x-rays. X-rays can miss in the initial phase. So MRI is considered to be the investigation of choice. 30-year-old limb is shortened, adducted, internally rotated is equal to posterior hip dislocation is what you have to remember. 25-year-old high-speed road traffic accident, severe pain, deformity and swelling of the thigh. So it is the shaft of the femur fracture. Common is a high-velocity trauma pulled by the flexors and abductors, the proximal fragment, and the distal fragment is pulled by the adductors. So the type of displacement is an external rotation and adduction of the limb is the attitude. And there is a Winquist-Hansen's classification, and we do a temporary fixation with Thomas splint, and we do definitive management with a intramedullary nailing with interlocking screws is what you have to basically remember. Right, doctor? So always this pictonomics, pictorial infographics is like reading a comic book. That's how your preparation should be, like reading a comic. A 12-year-old with a fever, anemia, and there is a onion peel periosteal reaction which is involving the diaphysis to make you to think of Ewing sarcoma, where T1122 is the most common chromosomal abnormality. A 9-month-old infant with fever, irritability, refusal to move the lower limb and painful restriction of the hip movement. So it's called Tom Smith arthritis. It's the septic arthritis in the pediatric population less than 1 year, where there is a destruction of the femoral epiphysis. Chondrolysis. There's a fever, irritability, refuse to move the limb, painless restriction of the hip movement and a hypermobile hip. Telescope test is positive. There is a limb shortening in delayed diagnosis is what you need to remember. So you need to be very sure. Tom Smith arthritis, which is the septic arthritis with the destruction of the femoral epiphysis of the head is what we need to remember. A 14-year-old obese, progressive limb, hip pain radiating to the knee and external rotation of the lower limb. X-ray pelvis shows posterior and inferior displacement to the femoral neck, while the femoral head remains within the acetabulum. What is the radiological sign called, doctor? Treatman sign. Head in the acetabulum, neck slips posterior-inferiorly. That's what you need to remember. So, slipped capital femoral epiphysis. Head remains in the acetabulum and the neck slips. Favorite question of the examiner. Perthes disease, congenital dislocation of the hip, congenital talipes equinovarus, slipped capital femoral epiphysis, all these things, doctor. Most common in the males. Obesity is a risk factor. So 13 to 17, so typically 15-year-old obese boy presenting with pain, limb, external rotation, either has hypogonadism, hypothyroidism, delayed puberty, you should think of slipped capital femoral epiphysis, and Treatman sign is what you need to remember. So now, doctors, a 3-month-old infant is diagnosed with developmental dysplasia of the hip in routine screening. What is the initial management? We put Paulic harness application. So age less than 6 months, Paulic harness or wound Rosen splint. 6 to 18 months, open or closed reduction. 18 to 13.6, femoral osteotomy. More than 3 years, varus derotation osteotomy plus pelvic osteotomy. Pelvic osteotomies can be Salter's or Pemberton's are 2 types. More than 10 years is an indication for the total hip replacement after skeletal maturity. And Paulic harness maintains flexion and abduction of the hip. Very important. If the conservative management fails, then you need to do closed reduction. But long-term developmental dysplasia of the hip is a risk factor for the development of the avascular necrosis of the femur, is what you need to remember. A healthy full-term newborn, multiple erythematous papules and pustules that show numerous eosinophils. He is otherwise feeding well and febrile. That's called erythema toxicum neonatarum, where there are pustules over the trunk 36 hours after the birth is erythema toxicum neonatarum, is what you need to basically remember. Similarly, epithelial inclusion cysts are called Epstein pearls. Right, doctor? Erythema toxicum is 24 to 48 hours. Pustular melanosis is at birth or less than 24 hours. That is the differentiator. Okay? So now, 2-year-old newborn develops poor feeding, lethargy, hypothermia, respiratory distress. It is early onset neonatal sepsis due to the maternal infection, due to the prolonged rupture of membranes with foul-smelling liquor before the delivery. That is called premature rupture of membranes, is more than 72 hours with foul-smelling liquor that lead to the infection, neonatal sepsis. So I leave the literature for you. Early onset sepsis, Klebsiella, Acinetobacter, Staph aureus. Late onset sepsis, E. coli, Listeria, and Group B streptococci. You should remember. A 3-day newborn has yellow discoloration extending to the palms and soles. So you should know, depending on the extension of the jaundice, you can judge. Zone 1, 5 to 7, Zone 2, 8 to 10, Zone 3, 11 to 14. Even legs are involved, 15 to 18. Palms and soles means more than 15. You need to be very, very sure of the various zones and visual assessment of the jaundice in the newborn. A 12-year-old boy with a short stature, his bone age is delayed compared to chronological age, but both parents have a normal height. Puberty has not yet started. So what does it come under? It is called constitutional growth delay, which is called late bloomers, is what you should remember. Here the bone age is delayed, but the final height that they achieve will be normal. Whereas familial short stature means bone age will be normal. That is the differentiator between the constitutional and familial. Please don't forget. Favorite question of the exam. If you forget, I can't help. Bone age delayed, constitutional. Bone age normal, familial. Final height is normal, constitutional. Final height is shorter, familial short stature, is what you need to remember. A 5-year-old boy, cyanotic congenital heart disease. He is irritable, tachypnic, previously heard, systolic murmur. So what is the appropriate management of cyanotic spell, doctor? Place the child in a squatting position, which will increase the systemic vascular resistance and decrease the right to left shunt, which will decrease the cyanosis. Always left to right is acyanotic, right to left is cyanotic. By making him to go to squatting position, you are increasing the pressure in the aorta. So fundamentally, aorta opens the mouth into both left and right ventricle. That is a problem in tetralogy of Fallot. So the right ventricular blood, which is bad blood, has a tendency to jump into aorta because that overriding aorta. If you make him squat, it will increase systemic vascular resistance, increase the pressure in the root of aorta, and prevent the movement of the blood from the right ventricle into the aorta and prevent the cyanosis, is what you have to basically remember. Similarly, alpha agonists like phenylephrine also, that increases the SVR. Anything that increases the systemic vascular resistance is good for the tetralogy of Fallot, is what you need to remember. A 2-year-old preterm child with delayed motor milestones. Increased tone hyperreflexia spasticity involving both lower extremities. It is spastic diplegic cerebral palsy where you find periventricular leukomalacia is what you need to basically remember. So, torch group of infections, birth asphyxia, intracranial hemorrhage, they're all perinatal etiological factors. Any meningitis can cause cerebral palsy. Now, doctor, a 4-year-old is being brought, difficulty to climb the stairs, waddling gait, calf muscle enlargement, Gober sign positivity, that means use of the hands to rise from the floor. Creatine kinase elevated typically is Duchenne's muscular dystrophy, where there is a mutation in the dystrophin gene, is what you have to remember. So I leave to you the 10 points, key points, doctor. आप गाय पढ़ो, नहीं तो हैरिसन पढ़ो, कुछ भी पढ़ो, अगर ये 10 पॉइंट दिमाग के अंदर नहीं घुसे तो ये टॉपिक नहीं पढ़े कि इक्वल है. तो इसलिए आप क्या करना है डॉक्टर, ध्यान से सुनो. What examiner want, you need to read and be very, very focused, laser focused in the last moment. Time is a valuable thing. Don't waste time running this coaching, that coaching and all that. Murli Bharadwaj is more than enough for you. So now, doctor, a researcher wants to study the association between asbestos between 1995 to 2005, that is retrospective cohort study. A screening test of a rare disease has a sensitivity specificity given. If the same test is applied to a population with very low disease prevalence, that lead to increase in false positive cases. Any rare disease, very low prevalence, mostly people are non-diseased, so their false positive cases will increase in a test which has got high sensitivity and a low specificity. That's the point. So positive predictive value is TP by TP plus FP, all positives in the denominator with true positives in the numerator. So increased sensitivity increases the true positives and increases the false positives, both of them. Then low prevalence means more false positives than true positives. And what increases false positives? So you need to be very sure about. A 32-year-old with chronic cough, weight loss, evening rise of temperature, TB, it is a CB naught, which will help you to detect the drug resistance in the shortest period of time. So you need to know all the important things with regard to the TB very clearly, right? Now, a state reports antenatal clinic HIV prevalence 1.4% and HIV among high-risk groups of 82%. So what this state belongs to? Category A. So you need to know how the states are being divided into various categories. ANC more than 1%, high risk more than 70%. Similarly, ANC less than 1%, high risk more than 75% is category B. Both of them less than 1% and 75% is category C, is what you have to remember. So, doctor, with this, we will call it a day. The remaining questions, please review on the PDF. And every week, 2 times, Thursday, Sunday, we will have test and discussion. Before day only, solve the paper and join the test. It is a very effective way to practice for the NEETPG 2026. Thank you.